Do you often experience a deep, aching pain in your shoulders after hours at your desk? Or maybe your legs feel stiff and sore after a tough workout or a long jog? You're definitely not the only one. Muscle discomfort is something millions of people deal with every day, and for many, a heating pad becomes the go-to solution for quick and comforting relief. But here's something most people don't realize: using a heating pad the wrong way can do more harm than good. Instead of easing your pain, it could actually increase discomfort, or even lead to burns or other injuries if not used properly. That's why in today's video, we're going to guide you through everything you need to know about heating pads, the benefits, the risks, and how to use them safely and effectively to soothe your muscles and feel better, faster. Heat therapy, also known as thermotherapy, has been trusted for centuries as a powerful, natural remedy for relieving muscle tension, stiffness, and spasms. Whether you're dealing with sore shoulders, tight calves, or lower back pain, applying heat to the affected area can make a noticeable difference. So how does it work? When heat is applied to your body, it stimulates blood circulation in that specific area. This increase in blood flow helps bring more oxygen and nutrients to the muscle tissues, which speeds up healing. At the same time, heat calms the nerves, reducing the transmission of pain signals and helping your muscles loosen up. That's why it's especially effective for chronic conditions such as tension from long hours at a desk, or pain related to arthritis and old injuries. But here's what many people overlook: heat therapy only works when used properly. Misusing it by applying heat too long, at the wrong temperature, or on the wrong type of injury can actually cause more damage than relief. That's why it's essential to understand when, where, and how to use heat safely for the best results. When it comes to heat therapy, not all heating pads are created equal. In fact, there are several different types on the market, each designed to meet specific needs and preferences. Understanding the options can help you choose the one that offers the most effective relief for your body. The most common type is the electric heating pad, which you plug into a power outlet. These often come with adjustable temperature settings, allowing you to control the intensity and duration of heat with precision. They're perfect for people who need consistent and long-lasting warmth for conditions like chronic back pain. Next are microwavable pads, typically filled with natural materials like rice, flaxseed, or buckwheat. You simply heat them in the microwave for a minute or two, and they provide a moist, comforting heat. These are great for short sessions or when you need a portable option without wires. Chemical heat packs are another convenient choice. They're single-use, air-activated, and perfect for on-the-go relief. Athletes or travelers often use them during outdoor activities or long trips. Lastly, we have infrared heating pads, which use far-infrared light to penetrate deeper into muscle tissue. Unlike surface-level warmth, this type of heat reaches the joints and deep muscles, making it highly effective for stubborn or recurring pain. So which one should you choose? It depends on your needs. If you're managing deep-seated, chronic discomfort, an infrared pad might be ideal. For quick, gentle relief, a microwavable pad could be your best friend. The key is knowing your body and selecting the right tool to support its healing. Before you settle in with a heating pad and enjoy that comforting warmth, it's important to recognize that heat therapy isn't always the right choice. In fact, applying heat at the wrong time or under the wrong conditions can be harmful rather than helpful, and in some cases, even dangerous. There are specific situations where heat should absolutely be avoided. For example, never use a heating pad on open wounds, cuts, or areas with visible infection. The added warmth can increase blood flow and potentially spread bacteria, making the condition worse. You should also avoid using heat therapy on fresh injuries, such as recent sprains, strains, or bruises, especially within the first 48 hours. During that initial period, your body is likely to be experiencing inflammation and swelling, and applying heat can actually intensify that swelling. In such cases, cold therapy is recommended first to reduce inflammation. Additionally, individuals with diabetes, neuropathy, or other conditions that reduce skin sensitivity should be extremely cautious. If you have a diminished ability to feel heat, you may not notice when the temperature becomes too high, which can result in serious burns without warning. Similarly, if you're taking muscle relaxants or certain pain medications, your body's natural ability to detect excessive heat may be altered. These medications can dull your pain receptors, making it harder to know when your skin is in danger. The bottom line? If you're unsure whether heat therapy is safe for your condition, it's always best to speak with a healthcare provider first. A few minutes of guidance can protect you from lasting damage and ensure your treatment brings comfort, not complications. To make the most of your heating pad and ensure safety, it's essential to follow a few simple but important steps. While heat therapy can offer real relief from muscle tension and chronic discomfort, using it the wrong way can lead to burns, skin irritation, or even worsen your symptoms. Step 1. Always use a protective barrier. Never place the heating pad directly on your bare skin, no matter how gentle the heat feels at first. Always use a thin towel, cloth, or the protective cover that comes with the device. This layer acts as a buffer, reducing the risk of burns, especially during longer sessions. Step 2. Set the proper temperature and time. Avoid the temptation to crank up the heat to maximum. Most of the time, a low to medium setting is enough to get the benefits without risking skin damage. Keep each session to a maximum of 15 to 20 minutes. Prolonged exposure or overly high temperatures can harm your skin or cause dehydration in the tissues. Step 3. Apply heat only to the affected area. Don't just place the pad anywhere. Apply it specifically where you feel soreness, tightness, or muscle knots. Common spots include the lower back, neck, shoulders, or thighs, areas that often carry tension from sitting, poor posture, or overuse. Step 4. Make yourself comfortable and stay still. Find a quiet place to sit or lie down in a relaxed position. Avoid walking, bending, or twisting while the heating pad is on your body. Movement can cause the pad to shift, fold, or press unevenly against your skin, creating hot spots that could lead to discomfort or burns. By following these steps, you can enjoy the soothing benefits of heat therapy with confidence and avoid the most common mistakes that people make with heating pads. Remember, the goal is gentle, consistent warmth, not intense heat. If you want to truly maximize the benefits of your heating pad, it's not just about turning it on and applying heat. There are a few key habits you can build into your routine to enhance effectiveness and support long-term muscle health. First, try pairing heat therapy with gentle stretching. After applying heat for 15 to 20 minutes, your muscles will be more relaxed and flexible, making it the perfect time to do light stretches. This helps improve range of motion and can prevent stiffness from returning. Second, don't forget to stay hydrated. Many people overlook the fact that prolonged heat exposure can lead to fluid loss in the tissues. Drinking water before and after your heat sessions supports healthy circulation and keeps your muscles nourished. Using your heating pad before bedtime can also be highly beneficial. The calming warmth not only eases physical tension but also helps signal to your body that it's time to wind down, improving sleep quality, especially for those who experience nighttime muscle pain or discomfort. And of course, always unplug your electric heating pad after use. Store it flat or loosely rolled to prevent bending wires or damaging internal elements. Regular maintenance is also essential. Check for frayed cords, cracked surfaces, or uneven heat spots. These are clear signs it may be time for a replacement. Remember, using your heating pad mindfully doesn't just relieve pain, it can become part of a smarter, healthier daily wellness practice. Even though heating pads are simple to use, many people unknowingly make mistakes that can reduce their effectiveness or worse, lead to injury. Being aware of these common errors can help you stay safe while getting the most out of your heat therapy. One of the most dangerous habits is falling asleep while the heating pad is still on. Especially if you're using a model that doesn't have an automatic shut-off function. Extended exposure to heat without supervision can cause serious skin burns, especially if the pad shifts or bunches up during sleep. Another frequent mistake is applying heat to areas that are numb, swollen, or inflamed. If you have reduced sensation due to conditions like neuropathy or recent injury, your skin might not register when the temperature becomes too high. By the time you notice something's wrong, damage may already be done. A third issue is ignoring the instructions that come with the device. It may seem like a basic appliance, but each heating pad is different in terms of heating levels, recommended duration, and safety features. Skipping the manual could mean missing out on important safety precautions. Whenever possible, choose a heating pad that includes an auto shut-off feature. These devices automatically power down after a set period, usually 15 to 30 minutes, which adds a layer of safety and helps conserve energy. It's a simple upgrade that can make a big difference in both peace of mind and skin protection. It's easy to get confused about whether to apply heat or cold when dealing with muscle pain or injuries. But choosing the right type of therapy can make a huge difference in how quickly you recover or how long the discomfort lingers. Here's a simple way to remember. Cold therapy is best for fresh injuries, especially within the first 24 to 48 hours. That includes things like sprains, swelling, bruises, or inflammation. Cold helps to reduce blood flow, minimize swelling, and numb sharp pain, making it ideal for acute injuries or sudden trauma. Heat therapy, on the other hand, is perfect for tight, stiff, or sore muscles, particularly when the discomfort is related to stress, overuse, or chronic conditions. Applying warmth helps increase blood flow, relax the muscles, and ease tension, making it a better choice for long-term aches or stiffness that won't go away. Still not sure? Here's a quick cheat sheet you can remember. Muscle stiffness, use heat. Swelling or bruising, use cold. Arthritis pain, use heat. Post-workout soreness, use heat, but only after the first 24 hours. Acute injuries like sprains or strains, use cold. If you're ever in doubt, start with cold in the early stages of an injury, then switch to heat after the inflammation goes down, or consult a healthcare provider for specific guidance. The right choice can accelerate your recovery and prevent further damage. While heating pads can offer temporary relief and comfort, it's important to recognize their limitations. If your discomfort persists even after multiple sessions of heat therapy, or if you begin to experience unusual symptoms such as numbness, tingling, or sharp, shooting pain, that's a strong indication it's time to seek professional medical advice. Pain that doesn't go away after a few days could be more than just muscle tension. It may signal a deeper issue like a pinched nerve, a herniated disc, or chronic inflammation in the joints or surrounding tissues. These conditions often require a comprehensive treatment plan, not just surface-level relief. While heat can reduce tension and make you feel better in the short term, it doesn't treat the underlying cause of more serious or structural problems. Using it repeatedly without addressing the root issue might delay proper diagnosis and treatment. So, listen to your body. If the pain feels abnormal, worsens, or lingers despite your efforts, don't hesitate to consult a doctor or physical therapist. A heating pad is a supportive tool, not a cure. Relying solely on heat without understanding what's really going on may cost you more time, money, and comfort in the long run. By now, you've learned everything you need to confidently and safely use a heating pad, from understanding when heat is appropriate, to avoiding common mistakes, and even maximizing its benefits through proper techniques and routines. With the right approach, heat therapy can become a simple yet powerful tool in your self-care arsenal. If you found this video helpful, don't forget to give it a like, subscribe to our channel Health Advice for You, and turn on the notification bell so you never miss out on valuable tips to support your health and well-being. Got a question about using heating pads? Or maybe another health-related topic you'd like us to cover? We'd love to hear from you. Leave a comment down below. Your input helps us create better content for everyone. And always remember, your health is your most valuable asset. When you take care of your body with intention and knowledge, it returns the favor in strength, energy, and resilience every single day.